childhood and adolescence, growth charts, developmental milestones, and pediatric diseases, with 4 answer choices and explanations. Childhood and adolescence, clinical vignettes, growth charts, and developmental milestones. 1. Failure to thrive. A 6-month-old infant presents with weight below the 5th percentile for age but normal height. The mother reports difficulty feeding and frequent vomiting. What is the most likely cause? A. Cystic fibrosis. B. Iron deficiency anemia. C. Growth hormone deficiency. Turner syndrome. Answer A. Cystic fibrosis. Explanation. FTT with vomiting and malabsorption suggests CF. Pancreatic insufficiency leads to poor weight gain. 2. Developmental delay in speech. A 2-year-old child has fewer than 10 words and does not follow simple commands, but has normal motor skills. Which is the most appropriate next step? A. Refer for autism spectrum disorder ASD evaluation. B. Start speech therapy. C. Reassure parents and recheck in 6 months. D. Perform brain MRI. Answer A. Refer for autism spectrum disorder evaluation. Explanation: speech delay and lack of social cues suggest ASD, warranting early evaluation. 3. Gross motor delay. A 15-month-old boy cannot walk independently but can stand with support. What is the most likely diagnosis? A. Duchenne muscular dystrophy. B. Normal variant. C. Cerebral palsy. D. Spinal muscular atrophy. Answer B. Normal variant. Explanation: walking by 18 months is within the normal range. Late walking alone is not diagnostic. 4. Short stature. A 10-year-old boy has a height in the 3rd percentile, but both parents are short. Bone age is consistent with chronological age. What is the likely diagnosis? A. Growth hormone deficiency. B. Familial short stature. C. Constitutional growth delay. D. Hypothyroidism. B. Familial short stature. Explanation: short parents and normal bone age suggest familial short stature. Pediatric diseases. 5. Congenital hypothyroidism. A newborn presents with large fontanelles, hypotonia, prolonged jaundice, and a puffy face. What is the most likely diagnosis? A. Congenital hypothyroidism. B. Down syndrome. C. Neonatal sepsis. D. Rickets. Answer A. Congenital hypothyroidism. Thyroid screening at birth is critical to prevent intellectual disability. 6. Kawasaki disease. A 4-year-old boy has 5 days of fever, conjunctivitis, rash, swollen hands, feet, and cervical lymphadenopathy. What is the most serious complication? A. Coronary artery aneurysm. B. Rheumatic fever. C. Infective endocarditis. D. Aortic dissection. Answer A. Coronary artery aneurysm. Explanation: Kawasaki disease is treated with IVG and aspirin to prevent coronary complications. 7. Acute otitis media. A 2-year-old has ear pain, fever, and bulging tympanic membrane. What is the first-line treatment? A. Amoxicillin. B. Azithromycin. C. Ibuprofen only. D. Tympanostomy tubes. Amoxicillin. Explanation: most cases of AOM are bacterial, strep pneumonia, H. influenza, and treated with amoxicillin. Strep pharyngitis. A 5-year-old has sore throat, fever, and anterior cervical lymphadenopathy. No cough. What is the best next step? A. Perform rapid strep test. B. Start antibiotics immediately. C. Obtain a throat culture. D. Administer corticosteroids. Answer A. Perform rapid strep test. Explanation: strep pharyngitis should be confirmed before starting antibiotics unless clinical suspicion is very high. Celiac disease. A 3-year-old presents with chronic diarrhea, weight loss, and irritability. Labs show iron deficiency anemia. What is the next step? A. Anti-tissue transglutaminase, TTG, IgA test. B. Sweat chloride test. C. Colonoscopy. D. Fecal leukocytes. Anti-TTG IgA test. Explanation: celiac disease presents with diarrhea and malabsorption. Anti-TTG IgA is the best screening test. Intussusception. A 9-month-old presents with colicky, abdominal pain, bloody stools, currant jelly, and vomiting. What is the best next step? A. Abdominal ultrasound. B. X-ray. C. Immediate surgery. D. IV fluids and observation. Answer A. Abdominal ultrasound. Explanation: ultrasound shows the target sign. Air enema is the treatment. Adolescence and puberty. 11. Delayed puberty. A 14-year-old boy has no testicular enlargement. What is the most likely cause? A. Constitutional growth delay. B. Klinefelter syndrome. C. Turner syndrome. D. Androgen insensitivity. Answer A. Constitutional growth delay. Explanation: delayed puberty in boys 14 years is often constitutional and self-resolves. Gynecomastia in adolescence. A 13-year-old boy has bilateral breast enlargement without pain. No other findings. What is the best next step? A. Reassurance. B. Testosterone therapy. C. Mammogram. D. Genetic testing. Explanation: pubertal gynecomastia is common and resolves in 1 to 2 years. 13. Adolescent depression. A 16-year-old girl has fatigue, low mood, poor grades, and insomnia for 2 months. What is the best initial step? A. Start fluoxetine. B. Refer to psychiatry. C. Recommend more sleep. D. Order a thyroid panel. Answer: explanation: adolescent depression requires evaluation. Fluoxetine is the first-line medication. Hash 14. Eating disorders. A 17-year-old girl with a BMI of 16 is obsessed with weight, has amenorrhea, and lanugo hair. What is the most likely diagnosis? A. Anorexia nervosa. B. Bulimia nervosa. C. Hypothyroidism. D. Body dysmorphic disorder. Answer: A. Anorexia nervosa. Low BMI, amenorrhea, and lanugo suggest anorexia. Hash 15. ADHD. A 7-year-old boy has difficulty concentrating, is impulsive, and struggles in school. What is the first-line treatment? A. Methylphenidate. B. Cognitive behavioral therapy. C. Parental training. D. Omega-3 supplements. Answer, might A. Explanation: stimulants are first line for ADHD. Would you like more vignettes on pediatric emergencies or genetic disorders?